Hi, I'm Dr. Steve G. Jones. Welcome to the Alchemy of Hypnotapping Wealth program. Here's a note about the difference in the steps between this program and my basic and advanced hypnotapping programs. The procedural approach that I will use in this program follows the same pattern that I teach in my basic and advanced hypnotapping programs. I have altered it here somewhat, only in that it is now a 9-step procedure, and this will make it easier to learn and apply. By the way, although it would be helpful, you will not need to have completed those programs in order to be able to learn and apply the information in this program. This is a standalone program. So it contains all of the information that you will need in order to use hypnotapping on yourself or others. If you want more details about the mechanisms of action in hypnotapping, the history of tapping, and how I decided on the steps in my hypnotapping program, please check out those programs. Another note before we begin, be prepared to deal with potential emotional fallout. So if you use this program on yourself and you have a history of mental challenges, then consult with a licensed psychologist or a medical doctor before using any of the techniques in this program. Similarly, if you use these techniques on others, please have the permission of a licensed psychologist or a medical doctor before you treat them. Here, in the Alchemy of Hypnotapping Wealth program, you are going to look at the procedures as numbered steps, which should enhance both your ability to learn and to recall the information. So here is how to use hypnotapping. It's done using these 9 steps that I have put on the board for you, and I'll be reviewing those shortly. But before we get to that, let's look at an outline of the entire program so that you understand what is in these modules. The first module, which you're watching or listening to right now, is Module 1. And in this module, we're just going to go over a refresher of how to do hypnotapping. And as I've mentioned, I've modified the technique, and it is now in a step-by-step procedural format. It's the same way, as I've mentioned, that I taught it in my basic and advanced hypnotapping program, but here in the Alchemy of Hypnotapping Wealth program, I have streamlined it into 9 steps. Same steps as you learned if you went through my basic and advanced programs. So in this module, we're just going to review that, and I'm going to show you the 9 steps so that if you didn't take either of those programs, you'll be just fine. In Module 2, we begin the practical application of the information. So in Module 2, I'm going to guide you through a hypnosis session on confidence for wealth creation. In Module 3, I'm going to guide you through a hypnotapping session on motivation for wealth creation. In Module 4, we're going to tackle abundance for wealth creation so that you can have an abundant mindset. In Module 5, we're going to look at creativity for wealth creation. You have to be able to generate new ideas if you want to generate new wealth. In Module 6, we look at letting go of limiting beliefs, and we're going to do a hypnotapping session around that. And finally, in Module 7, we're going to do a session on financial success for wealth creation, and that is going to be the crown jewel of this program. Then in Module 8, we'll tie it all together. But realize that in Modules 2 through 7, I will be taking you through sessions, hypnotapping sessions for wealth creation in one form or another, whether we're working on your confidence or creativity or your abundant mindset or letting go of limiting beliefs. We'll be working on something related to wealth creation. And then in Module 8, we'll sum it up. So let's look in detail now about the steps I'll be using in Modules 2 through 7 as I guide you through these hypnotapping for wealth sessions. First, let me briefly introduce each step, and then I will elaborate. So as you can see on the board, the first step is the pre-talk. The pre-talk is where you educate the client you're seeing, the person you're treating, you educate them about both hypnosis and tapping. And as I've said, I will elaborate on each of these after I initially go through this list. So the next step is the assessment. We want to find out where they are. That's a scale from 0 to 10. We find out how strongly they're feeling a negative feeling from the Dr. Steve 5, and we'll go over that. The next step is step 3, and here we do the induction where we're inducing them into hypnosis, and then the deepening with tapping. And in this case, we're using body tapping, starting from the top of the head and moving downward. Step 5 is finger tapping while thinking of the negative thought. Step 6 is the script. This is where we switch to positive ideas, where we're putting positive programming into their minds, or you're putting positive programming into your own mind if you're doing this yourself. Step 7 is the 9 gamut, and I will explain this. Step 8 is trans-termination. That's where we bring them out of hypnosis. Notice steps 3 through 8 are in hypnosis. They are in hypnosis during that. So trans-termination simply means in step 8 that we're bringing them out of the trance, and step 9 we're reassessing. We're finding out how we did. What is the number looking like? It should be reduced. So if they're feeling pain, let's say in the form of anger, and it was a level 8, we would expect it then to go to a lower level, anger level 5, for example. That's how we're going to check our results. So let's take a look at these steps in more detail, since you're going to be seeing them in action in modules 2 through 7. So starting in the next module, you'll be seeing these in action. So the first step, as I've mentioned, is the pre-talk. Now, the pre-talk is your opportunity to educate the person about both hypnosis and tapping in what we call hypnotapping. Now, in this case, we're working on hypnotapping for wealth. But anytime you're using hypnotapping, you're educating them just about hypnotapping. So whether you're working on wealth or anything else, the education part is going to be the same. So you should be telling them for both hypnosis and tapping what it is, how you use it, and what they should expect. So for hypnosis, it's a relaxed state of mind in which you are more receptive. How you use it? Well, you weave it into this session along with tapping. And what to expect? Well, in hypnosis, people usually feel relaxed. Sometimes they check out. Sometimes they're not aware of what's going on. Sometimes they don't remember the session. These things are normal and they happen. We're going to control this somewhat because we're going to keep the induction very short. Normally in just a hypnosis session where you don't need the person to interact with you, as you do in hypnotapping, where they need to actually do things, they need to tap on their body. You don't tap on their body, they do. So they need to do those procedures themselves. So we need them to be aware of what's going on. So we're not going to put them too deeply into hypnosis. You're using hypnosis to open their mind, to make them more receptive to the messages that they're going to receive. Also to make them more receptive to interacting with those emotions. Because when we get into hypnotapping, when we add tapping, we're dealing with a lot of emotions. We want them to be as open as possible to their subconscious mind to be able to tap into those emotions. So what it is, how you use it, and what to expect. So let's look at tapping in the pre-talk when you're explaining something to them. And also now I'm explaining it to you because you may not be familiar with it. So tapping is a way to interrupt the programs that people run. So for example, someone will have anger, let's say. Let's say they present with anger, and we want to allow them to either reduce that anger greatly or not have it at all, ideally. And in order to do that, we need them to run that anger program, and we're going to interrupt it. In my opinion, that's what tapping does. So you're thinking about how angry you are, and you're tapping different parts of your body. You're tapping different fingers, you're doing different procedures as we do in the 9 gamut, which we'll get to, and you're doing all of that while you're focused on that emotion. That causes it to be difficult to access that emotion in the future. So think about anything you're attempting to do. Let's say you want to focus on something. And while you're doing that, someone or yourself is tapping different parts of your body while you're attempting to focus on that. That's going to make it very difficult for you to focus on it. The next time you think of that thing that you were attempting to focus on, it's going to be more challenging because now, interwoven with the thoughts about that thing, whatever it may be, are these distraction memories, the memories of the distraction that was happening when you thought of it. So we're breaking up the program. This will become much more clear as we go through the procedures in action. So tapping is simply a way to interrupt the programs that they no longer want to run, such as anger or feeling embarrassed or feeling vulnerable or what have you. Something from the Dr. Steve 5, preferably, which we'll talk about in a moment. How you use it. You simply use it by tapping different parts of the body or doing different procedures, but let them know that at no time will you be tapping on their body anywhere. They will be doing that. So at no time will you be touching them. What to expect for the tapping should be a relief from the debilitating program they've been running. So if they've been running an anger program, it's going to be much more difficult for them to run it. That's the point of tapping. You're interrupting that program. The pre-talk is only done in the first session. Now, when I work with someone with hypnotapping or hypnosis, I spend 2 hours with them in the first session. 1 hour is spent just in the pre-talk. Now, also in the pre-talk, during that hour, you can also have them fill out any forms that you need to have them fill out. You can answer any questions. You can find out what's going on with them. You can get a lot done in that hour. But the main thing you want to deliver in that hour is the pre-talk. You want to educate them about what's going on so that they feel comfortable about it and they can ask any questions that they want to ask, just like I'm educating you now before we jump into this in Module 2. So the pre-talk is only in the first session. In the second hour, I do the procedures. Now, in the first hour, you can also do the assessment, which is step number 2. You can do that in the first hour. But starting with number 3, that's when we're in the second hour, because that's when hypnosis begins. And there should be some sort of an official announcement by you. Now you're going to go into hypnosis. So they need to be aware of that. It's important to prepare someone for hypnosis by letting them know what to expect. Just a relaxed state of mind in which they may or may not recall what happens, and that's fine. If they remember everything, that's fine. If they don't remember anything, that's fine. If they remember some of it, that's fine. They should feel very relaxed, but also realize that in hypnosis, they need to be focused on you and there should be no outside distractions of any kind because they're very open to suggestion. So you should be the only one talking with them. If you do your own hypnotapping sessions, you can record them either in audio or video to play them back. I don't suggest that if you want to use this on yourself, I don't suggest that you just go through each part live and do it with yourself. The reason is it's very difficult to be both the therapist and the patient at the same time. It's a lot easier to have it in a recording that you can follow along. So I recommend that if you want to do this with yourself, that you follow the model I'm going to present to you in modules 2 through 7, and you just create the sessions yourself, and then you can watch and or listen to them and just go through it that way. That way you've separated the therapist, if you will. You're still doing the procedures on yourself, but you're doing it from a recording so you don't have to look at what's next and where am I on the map and which step am I on. It's just all pre-done for you, which makes it nice and easy, just like you'll have in modules 2 through 7, or you can just let me do it for you as I will be doing in those modules. But if you want to take more direct control of it, I recommend you pre-record it. Moving on now to step 2. When you get to step 2, you are still in the first hour if you're working with someone. Now, on subsequent visits, if they come back for more treatments, then you're going to want to do the assessment just briefly before you begin. There doesn't need to be an hour for that. You just want to find out where they are. But the assessment allows us to see what's going on. And for that, ideally, we use the Dr. Steve 5. The Dr. Steve 5 is just a list of 5 emotions which are at the core of what people are feeling. So when people are having some challenges, if they can reduce it to one of the Dr. Steve 5, that can be very helpful. Usually, if you think about it, if you dwell on it a little bit, meditate on it, allow yourself to be comfortable with your feelings, usually you can get whatever you're feeling boiled down to something on the Dr. Steve 5. Either you're feeling sadness or anger or vulnerability or embarrassment, or you're feeling disappointment. It's not always going to happen that the person you're working with or even yourself will get it down to one of those 5. In fact, sometimes it's not even a word. It's simply a feeling that's difficult to express in words, and that's fine as long as they are in touch with that feeling and they can give it a number from 0, meaning not feeling it at all, it's really not an issue, to 10. So much pain related to that feeling, whatever it is, anger, disappointment, or some other word they have that describes it, or not a word at all, but just that feeling, that they can give it a number. So when you have it reduced to a word or just a feeling and a number, you need to have that number, then you have some control over it in terms of measurability. Because as you can see, step 2 is assessment. Step 9 is reassessment. We're going to look at the same feeling they had and find out what number it is at that point. So the idea is you can think of this as sort of like a car wash where different things happen to the car, different scrubbing happens, different water sprays happen, different types of detergent are applied and so forth. And the car comes out the other end cleaner. Maybe not perfectly clean. Maybe it needs to go back through again, but it comes out cleaner. That should be happening. Now, if you're having a situation where they go through everything and the number's not reduced, when I say cleaner, that's what I mean. The number should go down. Let's say it was anger level 8. Now it's anger level 5. Well, we've made an improvement. We've cleaned the car somewhat, if you will. The car wash has worked. If it's not working, why use it? That's why we need to reassess. We need to see if it's working. Usually what will happen is there will be a reduction, and then if they go through it again, there'll be a further reduction. If you go through the exact same procedures again with that same emotion in mind, let's say it went from anger level 8 to anger level 5, there's a good chance that you'll get it even lower, anger level 3, for example. So it can be helpful to rinse and repeat, so to speak. But that's up to you, and it depends on the time that you have with that client. But just doing it once will be very, very beneficial in most cases. Now, when you get this number from them, you want to write it down. And you want to write it down whether you're working with yourself or someone else. The reason for that is it's often difficult to even believe that they were at that level. So let's say they had embarrassment level 10. And they come out the other end and you reassess and it's embarrassment level 1 or level 0. There's no embarrassment at all. They're not even able to get in touch with that anymore. That does happen. In that case, they may find it very difficult to believe that they are ever at level 10. I know it sounds shocking that they wouldn't believe that they are at that level, but the change can be so profound. And we're talking about working your way through this from steps 3 through 9 within the course of an hour. So within the course of an hour, they can go potentially from a level 10 to a level 0, or a very high level to a very low level of feeling that pain. And that's wonderful. But what happens in many cases is they don't believe they were ever feeling it that powerfully. They don't believe they ever had that much anger because they're not feeling it anymore in the reassessment. So all you have to do is write it down and show it to them at the beginning. In step 2, the assessment, they tell you a word, preferably something from the Dr. Steve 5, and a number, and you write it down and you show that to them. You show them you writing it down. You're physically writing it down and you're showing that to them. That way, when they look at it afterwards, they will believe and they will understand the power of what they've just gone through. It's a byproduct of hypnosis and tapping, that the person goes through the procedures, comes out the other end feeling great, and thinks, well, I don't need this, I'm perfectly fine. Not realizing anymore, not being able to get in touch with anymore how they felt just an hour ago. So you want to do this so that you can show them the power of what you're doing, and you can get credit where credit is due. Also, when you work with yourself, you want to be able to see where you were, because sometimes you will, just like them, have difficulty believing that you were ever feeling those emotions that intensely. So write it down, whether you're working with yourself or others. Write down in number 2, write down the emotion and the intensity. As I've mentioned, steps 3 through 8 are in hypnosis. You or they will be in hypnosis. It's very important, as I've mentioned, to prepare for this. One of the things you want to do to prepare for it is to tell them that they may have what's called an abreaction. An abreaction is just an abnormal reaction. Maybe a lot of extra emotions are coming out. Now, you would expect emotions to occur, to be expressed, in other words, during this type of session. That's the reason why you're getting the consent of a medical doctor or a PhD psychologist before working with anyone, because of the emotional fallout, so to speak. That doesn't have to be a negative thing. It's just going to be their emotions coming up. You want to make sure that you have the consent of one of these professionals so that you can rely on them if there's something that happens to the person where they need some counseling afterwards. You must understand that if you are just trained in hypnotapping, you are not trained to deal with emotional fallout of that level, whether it's with yourself or someone else. So if you yourself have a history of mental and or emotional challenges, or your client has that, make sure you have permission in either case, whether it's yourself or someone else that you're working on. Make sure that you have the permission of a medical doctor or psychologist who will also be available if something happens. Usually nothing happens, but sometimes with this technology, you can tap into some deep-seated emotional trauma. It can be unleashed and you will not know how to deal with it. So be very careful when using hypnotapping. So let's talk about the hypnosis session now. The hypnosis session, as I mentioned, begins with step 3, the induction. In the induction, if you're working with someone and making a recording for them, you'll want to say at the beginning of the recording, whether it's video or audio or both, that you're going to address any residual emotions related to this issue. And what I mean by that is you're going to pay attention to the fact that you may have already worked with them. So if you think about it, if someone has a recording of the session, video or audio, and they've already gone through the assessment and they've gotten, let's say, level 8 anger, and they've gone through the reassessment, they've gotten to level 5 anger, and now they're going to use the recording again. Well, in the recording, you want to say that you're addressing any residual emotions so that they don't get the sense that they're starting all over again. So in other words, that little sentence that you're adding, that you're going to address any residual emotions, pays attention to and gives credit to the fact that they may already have reduced it from a level 8 to a level 5, for example. Now we're addressing the residual emotions. So now the subconscious mind knows to focus on those rather than just starting over every time. If you think about using a recording and you're starting from scratch every time with the full force of the emotions, but that's not really where you are because you've already worked on it and there's a mismatch. So all you have to do for this part is to say that you're addressing any residual emotions if you're making a recording for them. As I've mentioned, you want the induction to be about 5 minutes. Now, normally an induction that I do with my clients in my office will be about 30 minutes if it's for a hypnosis session only. But with hypnotapping, they have to be interactive. So they have to be paying attention to what's going on. They have to do things. They have to tap different parts of their body. So in order for that to happen, you need them to be relatively aware of what's going on. So the induction, you want to keep that fairly short. The deepening can be fairly short also. So the induction should be about 5 minutes. the deepening would be about an extra minute or two. Generally, as I've said, these would be longer. The induction would be more like a half an hour, and the deepening could be up to 10 minutes. But we want to condense that because we don't want them going too deeply into hypnosis to the point where they're not interactive. The induction is where we're just relaxing them into hypnosis. We're going to paint a scenario for them, whether it's the beach or walking in the woods or something else relaxing. We're just going to relax them into hypnosis by having them focus on a relaxing scene. That's all the induction is, and it's very short. The deepening is an intensification of that. So if the induction, part 3, was them walking on a beach, the deepening can be the sun setting. And in the deepening, we get into tapping also. So in the deepening, they're going to be tapping different parts of their body, and we're correlating different things here in the deepening. So if you imagine that you have just gone through an induction where you're just walking on the beach and relaxing and enjoying that for about 5 minutes, then the deepening would be you sitting down and watching the sunset, for example. And we're correlating different things. We're correlating downward counting, so we're counting from 10 to 1, with downward relaxation and downward tapping and exploring the feeling. And specifically, they're exploring different aspects of the feeling. So again, if it's anger, then they're exploring different aspects of that feeling. I feel angry when this happens, or I feel angry because of that, whatever it may be. And they're exploring the different aspects of the anger as they tap downward. So let's take a look at how this works. You would say something such as, now you're going to relax more deeply as the sun sinks lower and lower on the horizon. And as it does, you're going to explore different aspects of blank, of the emotion that they have presented with, the feeling that they have, the negative feeling. And again, the reason for that is that we want to break up their ability to run that pattern. So you're attempting to run that pattern, but you're relaxing more as you run it. So think about that. You're thinking about your anger, but you're relaxing more because you relax more deeply as the sun goes down. You're also tapping. So it becomes more difficult to run that anger program. That's the idea here. That's the mechanism of action. We are interfering with the program. We're also correlating the anger with downward relaxation. So in the future, when they attempt to get angry, it's already paired with relaxation. So that's a benefit. Also, it's difficult to run that program because now they have all the interference of thinking about tapping all these different body parts. So we just go from head to hand. So we start with 10, relaxing more and more as the sun sinks lower and lower and you explore a different aspect of blank. And with 10, you're not tapping anything. With 9, you're tapping the top of your head as the sun sinks lower. I explore a different aspect of blank, anger, for example, and I relax more deeply. 8 is the inner eyebrow. You repeat the same type of sentence structure. As the sun sinks lower and lower, I'm now tapping my inner eyebrow. And you can tap with 1 finger, 2 fingers. I usually use 2. You can tap on both sides if you want. It really doesn't matter. But I'm going to normally tap with 2 fingers. And then, so this is 10 is not tapping anywhere. 9 is the top of the head. 8 is here. 7, side, the eyes, either side or both. 6 is under the eyes. 5 is under the nose. 4 is under the mouth. 3 is the collarbone. 2 is under the arm. Anywhere, doesn't matter exactly where you go or which side you use. This is number 2. And finally, 1 is what we call the karate chop point. You're just tapping here on the side of the hand. Either hand, doesn't matter. Now, the final aspect of the deepening that we're going to coordinate with downward counting, downward relaxation, downward tapping, and exploring the feelings is imagining motion. Something, or them, or you, will be moving down, toward something, away from something, etc. You'll see that in action starting in the next module, as with everything else I'm describing here. So that's part 4, deepening with body tapping. Step 5 is finger tapping. All you're doing is tapping your fingers. Now, I recommend if you're looking for a spot to do it, I would do it in the upper part of the finger or thumb, right next to the nail, right about here on either side. But you're tapping from your thumb to your pinky. And as you're doing it, or as they're doing it, they're again thinking of that negative feeling. Anger, for example. And again, we're breaking up that pattern. So they're running the pattern and we're interfering with the pattern. The idea is that after the session, they're going to have difficulty getting in touch with that anger because we've had them think about it and feel it, but we've added all of these things. Tapping, we're going to even add more things as we go through the car wash, if you will. So this is where we're doing a lot of cleaning. We're interrupting that pattern. We're making it very difficult to run that pattern. So simply, you tap the side of the thumb. This is the way I do it with one finger or two. And then you tap the side of the index finger, and then the middle finger, the ring finger, and the pinky. If you want to know how many times to tap, it really doesn't matter, but the idea is you have to get your attention. It has to be something that does get your attention. It shouldn't be something that's just easy to ignore, because if you think about it, we're attempting to break up the pattern. In order to do that, we need to interfere with the person's thinking. If it's something that's very pleasant, such as just rubbing or something, that is probably not going to do it. We want it to be something that interferes with them, just like tapping the different parts of the body. We want to really interfere with their thinking. So you want to tap hard enough not to do any damage or hurt yourself, but you want to have them tap hard enough, or you tap hard enough to really get your attention. Okay, this is somewhat annoying. That's the way it should be. It shouldn't be something pleasant that you're doing. It should be somewhat annoying. So I'm tapping hard enough to get my attention. Okay, now I'm paying attention to this. Okay, so if you want a number, I'd say 7 times you can do this. I wouldn't do it any more than 1 minute. So even if you do it a lot and you just keep going, you feel like, well, I really need to get my attention. I really need to tap in there and get my attention. Don't do it any more than 1 minute, because then you're going to get too caught up in just doing one little part of it. So ideally, about 7 times, a reasonable amount of pressure. You're not hurting yourself, just getting your attention, tapping here, thinking about the negativity, tapping here, thinking about the negativity, the anger, or whatever it may be, moving on, moving on, moving on. That's all you're doing in part 4 with yourself or with them. Remember, with them, you're not tapping on them at all. They're tapping on themselves, which is, as I've mentioned, the reason we want to do a short induction. We don't want them so deep into hypnosis that when you say tap, they just kind of sit there and don't do anything. If that happens, you need to bring them up a little bit out of hypnosis. And we'll discuss that in trance termination. Also, if you have an abreaction, if they have an abreaction and you are dealing with it, you want to bring them up out of hypnosis. So anytime there's an abreaction with yourself or with someone else, go directly to trance termination and bring them out of hypnosis. Now, a note about tapping, it really doesn't matter which order you tap in. I'm just giving you an order here so that you have something to follow. If you want to make up your own order, or if you want to reverse the order or go from bottom to top when tapping, it really doesn't matter. It's just the idea that you're interfering with the pattern. That's what matters. So the only reason I'm giving you an order here to do things is so that you have an order to do things, so that you have some sort of template to use. But if at some point you decide, well, it would be far more annoying if I tap the back of my head, then feel free to do that. But I'm giving you a template so that you can have something to follow if you work with yourself or others, so you don't have to think about what to do. So next we get into the script. The script is where the change happens. This is where we're just putting positive messages in their mind. We've had them focusing on negativity, the anger in our example, but now we're focusing on the positive. We're putting positive thoughts in their mind. You are amazing. You are powerful. You are calm. Things of that nature. And I'll show you specific examples as we move through modules 2 through 7 together. Also important in the script is future pacing, where they're seeing themselves in the future, having let go of that anger or that embarrassment or that vulnerability or whatever the negative emotion is. They see themselves in the future. I usually use 6 months in the future, see themselves in the future, living free from it. They've let it go completely. That's the ideal picture you want to paint. Now, they may not live into that ideal picture. In other words, 6 months from now, it may not be gone completely, but you have a much better chance of it succeeding if you do paint the picture that way. See yourself 6 months in the future having let go of all that negativity and being calm in every situation because you have found productive ways to deal with your emotions. The next step is step 7, the 9 gamut. And in the 9 gamut, we're going to take them through a set of procedures while they're again thinking about the negative emotion. And this set of procedures is going to allow them to run the program, but have it interrupted. Again, the same concept we've been applying. So here is another part of the car wash, if you will, in which we're applying something that's going to further interfere with our ability to run that negative program. Before we get into that, I want to point out the gamut point, which is about here. It's between the pinky knuckle and the ring finger knuckle and about an inch down. Here's the gamut point, and you can just tap on that. I usually do it with 2 fingers. Again, it doesn't matter how many fingers, and you also don't need to get it exact. It can also be in either hand, but they're tapping this the whole time. That's just adding to the interruption of the pattern. So they're tapping this the whole time that they're doing the 9 gamut. It's called the 9 gamut because they're tapping the gamut point, which is right here, the whole time. So while they're doing this, they do these 9 procedures for 5 seconds each. The first one is closing their eyes, or your eyes, and opening your eyes while keeping your head still, looking down and to the right. So it looks like this. Then, while keeping your head still, looking down and to the left. Step 5, roll your eyes in a clockwise motion. Step 6, roll your eyes in a counterclockwise motion while thinking of the negative feeling and tapping the gamut point. Step 7 is hum any song. It should be a non-triggering song. They shouldn't hum something that triggers the emotion they're working on. So if they hum a song from their childhood and it triggers that emotion, they should choose a different song because we want to interrupt the pattern, not reinforce the pattern. So hum any song for 5 seconds. It can be any song. It doesn't matter as long as it doesn't trigger anything. And they're doing this while they're tapping the gamut point and thinking about the negative emotion. Next step, step 8, is count to 5 out loud. That's simply 1, 2, 3, 4, 5. Again, while tapping the gamut point and thinking about the negative emotion. You can see how we're interfering with that pattern. It's very difficult to focus on anything while you're doing these things. That's the idea. We're breaking up the pattern, so it's more difficult to run in the future. Step 9, hum a different song. And that is the 9 gamut. That is step 7. The next step is step 8, trance termination. Now this is where we terminate the trance. So they've been in hypnosis between steps 3 and 8. Now we're going to bring them out of hypnosis. They need to come out of hypnosis in order to do the reassessment. And also to leave your office if you're treating them in an office or in person, or if you're listening to or watching a video of a session, you need to come out of the session so that you can get on with your day. Unlike hypnosis, which I recommend listening to at night as you go to sleep, hypnotapping is something that I would recommend doing when you have the intention of returning to full awakening consciousness, because you have to do the reassessment. You have to find out where you are, and you want to do that while you're fully awake. So we bring them out of hypnosis. This is a simple matter of counting to 3 by saying, in a moment, I'm going to bring you out of hypnosis. When I do, you'll be wide awake and completely out of hypnosis. And then you begin counting 1, coming up, 2, beginning to move, beginning to stir. And as I go through each number, 1, 2, and 3, I'm increasing my volume and becoming more lively in my voice. And at the count of the next number, you'll be wide awake and completely out of hypnosis. That's me preempting it. So between 2 and 3, I'm preempting it. I'm saying that when I get to the number 3, you'll be completely out of hypnosis. So 1, coming up, feeling good. 2, beginning to move, beginning to stir, coming more and more out of hypnosis. And at the count of the next number, you'll be wide awake and completely out of hypnosis. All right, 3, wide awake and completely out of hypnosis. If they don't come out of hypnosis, or you're not seeing any signs of them coming out of hypnosis, just ask them how they're feeling. If there's no response, you'll want to repeat steps 1 through 3, but your new step 1 starts with the volume of the former step 3. So you increased your volume up to here, let's say, or your new step 1 starts here and builds from there. So you're getting even louder. The idea is to bring them out of hypnosis. So the next step, the final step, is step number 9. That's the reassessment. That's where we are seeing how we did. And again, that's on a scale from 0 to 10. There should be the word, anger, or something else that they were expressing, or just that feeling. Maybe it's not a word, and that's fine. Or maybe it's a word that's not from the Dr. Steve 5, and that's fine. But whatever it is, there should be a number associated with it. And here is where we're going to, after they reveal the new number, let's say it's now anger level 5, we show them where they were so that we can show them that they're making progress. Sometimes there's not a change. That's very rare. If there's not a change, then you may want to use a different procedure for them besides hypnotapping. But if there is a change, you can use it again with them to get an even lower number. That depends on how much time you have to work with them or work with yourself. So this concludes Module 1. Now you understand how to use hypnotapping. Starting in the next module, Module 2, you will see it in action. And we're going to work on confidence for wealth creation in the next module, so join me there. I'm Dr. Steve G. Jones, hoping you have an outstanding day.